Imagine what a country would look like if there were shortages of chicken and turkey at the end of the year. The deadly avian flu pandemic that is presently sweeping throughout America is not worrying more people than it should. On February 8, the first confirmed instance of highly pathogenic avian influenza, or HPAI, in a domestic U.S. flock was found. We released a video grieving the death of more than 2.8 million birds, predominantly hens and turkeys, in the first month of the outbreak on March 9th, just over a month later. Even though this outbreak is just 2 months old, it has already claimed the lives of almost 17 million baby fowl and turkeys. The unsettling issue is that bird flu continues appearing in new areas across the nation, and no one can explain why it is spreading so quickly. In actuality, the USDA just disclosed 5 more outbreaks. The Highly Pathogenic Avian Influencer, HPAI, has been confirmed by the Animal and Plant Health Inspection Service, APHIS, of the United States Department of Agriculture to be present at a commercial poultry farm in Johnston County, North Carolina, as well as in backyard flocks in Massachusetts, North Dakota, Ohio, and Wyoming. We have learned that Oklahoma has now been affected by the epidemic as well. According to state officials, the first occurrence of avian influenza in Oklahoma's wild bird population is being looked at. The first wild bird in Oklahoma to be verified to have the highly dangerous Eurasian H5 strain of avian influenza is a wild duck in Payne County, according to authorities with the Oklahoma Department of Agriculture, Food, and Forestry. State Veterinarian for Oklahoma, Dr. Rod Hall, stated that he encourages poultry owners of all sorts to continue to be cautious, maintain excellent biosecurity, and report ill or diseased birds promptly. Symptoms of HPAI in poultry include the following: decrease in water consumption, lack of energy, lack of appetite, decreased egg production, soft-shelled, misshapen eggs, nasal discharge, coughing, sneezing, incoordination, and diarrhea. Experts emphasize that even if a bird is not exhibiting any signs, the virus can still cause unexpected death, with cases of highly pathogenic avian influenza now confirmed in 23 different U.S. states. Dr. Hall stated that, "We're asking that anyone involved with poultry or egg production, from large farms all the way down to backyard flock, review and implement their biosecurity practices to ensure the health and well-being of their flocks." According to Bloomberg, the total number of chickens and turkeys killed has now reached nearly 17 million. On Wednesday, a fatal bird flu variant that has been driving up egg costs ahead of Easter was found in 5 additional U.S. states, and the virus is now posing an increasing danger to American poultry exports. In a press statement, the U.S. Department of Agriculture stated that since mid-January, flocks totaling approximately 17 million birds had been discovered in 23 states. The entire flock must be culled if even one bird tests positive for highly pathogenic avian influenza. Not a single bird may be left alive. Are we all going to become vegetarians if this pandemic continues to get out of hand? There have been 9 outbreaks in Iowa since the beginning of the month, according to Iowa Agriculture Secretary Mike Naig, making the state of Iowa particularly heavily struck, too, in 7 commercial facilities and backyard flocks. With the most recent round of bird deaths, the statewide total of dead birds reached around 8.2 million, or roughly half of the birds killed nationwide by the highly virulent avian influenza. The greatest producer of eggs and turkeys in the country, respectively, is Iowa. It goes without saying that the cost of eggs will skyrocket. We will experience serious shortages if the death toll keeps growing exponentially. Additionally, let's hope that HPAI doesn't evolve in a way that makes it simple for people to get it, as the official CDC website reports that the mortality rate for bird flu in humans can reach 60%. Since November 2003, the World Health Organization has received reports of more than 700 human illnesses with Asian HPAI H5N1 viruses, mostly from 15 nations in Asia, Africa, the Pacific, Europe, and the Near East. Up to this point, the countries with the most human HPAI Asian H5N1 cases include Egypt, Vietnam, and Indonesia. The first human case of Asian H5N1 infection in the Americas was discovered on January 8, 2014, in Canada, in a traveler who had just returned from China. Although this virus seldom infects humans, over 60% of instances have resulted in death. Human respiratory tracts have been infected with Asian HPAI H5N1 viruses, which can lead to pneumonia, respiratory failure, and in rare cases, death. Asian HPAI H5N1 infections have primarily affected children and individuals under the age of 40, with those aged 10 to 19 seeing the greatest fatality rates. The majority of Asian HPAI H5N1 patients in young people have been hospitalized with severe respiratory symptoms and have just recently sought medical attention. However, several clinically mild occurrences, particularly in children, have been observed. The source of exposure for certain HPAI Asian H5N1 patients is unclear. Numerous HPAI Asian H5N1 cases in humans have appeared at the same time as seasonal poultry epidemics of the virus. Human cases can happen at any time, particularly in nations where the HPAI Asian H5N1 virus is widespread in poultry. Currently, 6 nations, Bangladesh, China, Egypt, India, Indonesia, and Vietnam, are thought to have an epidemic HPAI Asian H5N1 virus in poultry, even though there have been outbreaks of poultry in other nations. It is clear that the conditions are being put in place for the dreadful global food catastrophe that has long been predicted when you combine this epidemic with the conflict in Ukraine, increasing fertilizer prices, and poor crops all over the world, even though they have repeatedly been warned about what is to come. Most people just expect that our grocery stores will always be stocked with mountains of really inexpensive food. As a result, the great majority of them won't take any action to prepare. Thank you for watching. Please subscribe to our channel.